everyone, in this video I teach you how to identify different types of burns, their classification, signs and symptoms and treatments, in which I'll teach you how to first aid or acute management in the A&E settings, and lastly the skincare after discharge. Before that, let's watch some scenario I have created. Enjoy!
Les poils étaient pignons, les vitons j'étais, et les jantons les opas, les gisons l'étaient, en poids je les dents, les tisponnerons, mon dans les opas, les gens les opas, les gens les tuis, en lisiona, dans les dents. Les dedans.
So, what can you conclude from the scenarios given? Burn is common in domestic, especially among children. So I'll explain further in the next video. Burns happens when your skin is in contact with thermal heat, such as fire, boiling water, steam, extreme cold, electrocution or lightning, acid, sunburn, and even radiation that causes injury, protein denaturation, and cellular damage in the skin. The skin is the largest organ as a protective barrier and preserve hydration. The classification of burns depends on the extensive damage to the skin layer. For the first degree burn, it involves the epidermis layer, or also known as the superficial burn. For a second degree, it happens when it affects the epidermis and dermis layer, which can be further divided into papillary layer, or also known the superficial partial thickness, or deep partial thickness for the reticular layer, which does not involve the whole dermis layer. For a third degree, it involves full thickness of the epidermis and dermis. Meanwhile, for the fourth degree, it involves all layers until the hypodermis. The sign and symptoms it depends on the degree of burn. For the first degree, it may look red, dry, painful, and blanched due to constriction of blood vessels. For the second degree, it may look red, blisters, and painful for the papillary layer. However, for the reticular layer, it may look pale with blister. For the third degree, it may look waxy white, leathery gray, painless due to nerve damage, and stiff. For the fourth degree, it may look charred black, dry, with patches of dead skin which may extend to the joints and bone. Severity of burns depends on the percentage of total body surface area of each body parts and its difference between adults and children. You can see the diagram here to differentiate. First aid for burns mainly have three C's, which are cool, call, and cover. These are mainly for first degree and second degree of superficial partial thickness, which can be managed at home with or without medication.
Dominique, nique, s'en allait tout simplement, routier, pauvre et chantant. En tout chemin, en tout lieu, il ne parle que du bon Dieu, il ne parle que du bon Dieu. À l'époque où Jean sans terre d'Angleterre était le roi, Dominique, notre père, combattit les albigeois. Dominique, nique, s'en allait tout simplement, routier, pauvre et chantant. En tout chemin, en tout lieu, il ne parle que du bon Dieu, il ne parle que du bon Dieu. Certains jours, un hérétique par des ronces le conduit, mais notre père Dominique par sa joie le convertit. Dominique, nique, s'en allait tout simplement, routier, pauvre et chantant. En tout chemin, en tout lieu.
Okay, moving on to the emergency management at the A&E. It can be divided into primary and secondary survey. For the primary, we'll check for the A, B, C, D, and E. A stands for the airway to see any patency or any fracture of the cervical. B to see any SpO2 or any chest movement for breathing. C to check for any circulation. You can check the pulse or the carotid pulses or and set any IV line for resuscitations and also blood investigation. D for disability of the Glasgow Coma scale. E for exposure for any hidden trauma or fractures and we need to evaluate. Next, we can proceed to fluid resuscitations or given any analgesia such as morphine as a painkiller. For the secondary survey, we would like to re-evaluate and reassess what has been done in primary survey. We would like to monitor the urine output, vital signs, full blood count such as hematocrit to see any signs of shock, arterial blood gas, chest X-ray, electrocardiogram, and central venous pressure. The main goal of fluid resuscitation is to sustain tissue perfusion while minimizing the interstitial edema. So it's indicated in second to third degree of burn involving 10 to 15% of total body surface area. And the principle is to maintain the organ perfusions, to continue the titrations, and to prevent any over resuscitation that can lead to compartment syndrome. Isotonic crystalloid is chosen for fluid resuscitation in the first 24 hours is because colloid may worsen the edema as it increase in vascular permeability if given in the first 8 to 24 hours. Here is the formula to calculate fluid resuscitation based on the body weight and percentage of burn. This diagram shows different types of formula for fluid resuscitations based on different types of fluid in adults and children. Bear in mind, children normally require addition of maintenance fluid and albumin as their serum plasma albumin rapidly decrease. For surgical management, wound debridement, escharotomy, spleen skin grafting are provided as shown in the diagram below. Before discharge, the doctor would advise some skin care to their patients such as wound cleaning using soap and water, gentle debridement to remove any slough, topical antimicrobial to prevent any infections like Pseudomonas aeruginosa, and to change frequently their bandages and make sure it's comfortable and protective. This diagram shows different types of bandages and their functions for first and second degree of burn. That's all. Thank you for watching.